I had always considered myself to be a holistic dentist in that I was opposed to placing mercury fillings in people's mouths and had been for 20 years. Interestingly enough, even though I had been the picture of health and never missed a day of work, all of a sudden I began to have neuromuscular issues. I was finally referred to a ALS center, a center that treats Lou Gehrig's patients in Houston. As a result of that, I called a dentist who had lost his license in this country years ago, actually, for telling people to have their mercury fillings removed. He had seen patients for years and had treated many people with autoimmune issues. I went to Montreal to see him, and in the course of that treatment, I learned so much from that gentleman, and he took me through a body chemistry analysis where he analyzed my blood and hair. And he actually encouraged me at that time to have all of my dentistry changed out into biocompatible materials. So as it turns out, if you can imagine, all of the dentistry in my mouth, even the white bonded fillings that had replaced my mercury fillings, all of that was highly reactive for me. So we replaced those materials. Interestingly enough, I began to have a significant recovery. I actually went from Montreal to Houston to be checked at the Lou Gehrig Center there. And as it turns out, I did not get that diagnosis. My issue is strictly a toxicity issue. And so one of the reasons why I'm so thankful for the opportunity to treat patients is because I feel like I have been in their shoes.
Our philosophy as far as treating our patients is that what's in the mouth affects the body, and what's in your body is also affecting your oral health. And so our goal is to treat each patient individually with exceptional care and to make sure that we provide them with the education that they need and the care they need so that they can reach optimal health.
We consider ourselves a practice that focuses on the whole body and wellness, and we also want to treat the whole family. You know, we want to see the little ones and see them all the way up into adulthood, because we know that what we do is healthy and it's giving them a good foundation dentally.
Periodontal disease is destruction of the gum tissue and the underlying bone that supports a tooth. That happens via bacteria that are in our mouth, and if those bacteria sit much like termites would in a foundation, if they sit and are not disturbed, they continue to disrupt the foundation to the point of where you would eventually lose a tooth. In the process of that, though, those bacteria have a high degree of toxicity associated with them. And not only that, those bacteria are released into the bloodstream. And the combination of that, their toxins and their inflammatory effects, all of that can produce systemic illness. The wonderful thing about periodontal health is now, via the use of a microscope where we can examine and see what bacteria are in a patient's mouth long before the disease manifests itself, we're able to nip that in the bud. So that's really what sets us apart. We have an absolutely fabulous periodontal staff and department, some of the best trained hygienists and hygiene assistants in the world.
When a patient comes in, one of the first things we do is we do several screenings. We do a phase microscope where I take plaque, put it on a slide, look at it, and it can tell me what's going on in the mouth. It gives me the true story. That just really puts us ahead of the game. It catches the infection before permanent damage is done in most cases.
Because of the latest research that shows a link between periodontal disease and heart disease, lung disease, diabetes, preterm babies, we want to make sure that our patients are not at risk for any of that.
I began to become aware of research regarding the toxicity associated with a root canal tooth probably 8 or 9 years ago. Some very good research was coming from the University of Kentucky by a very well-known biochemist regarding the toxicity associated with root canal teeth. I could hardly believe that when I began to read it, and then, quite frankly, I went to see that biochemist and see the research, and I became convinced that root canal teeth, a dead tooth, truly has a toxicity associated with it that I think can so influence our systemic health that I could no longer do a root canal in good conscience.
You know, there's no other place in the body that we leave something that's dead. If there's any place else in the body that you have something that dies and that is no longer receiving a good blood supply, we know in the medical community that you have to remove that part of the body because it's not healthy.
We've been conducting our own study regarding root canal teeth. This particular study deals only with the very best root canal teeth, perfect on x-ray and asymptomatic. In excess of 98% have tested severely to extremely toxic. So we're talking about teeth that have toxicities, quite frankly, that make toxins like botulism toxin, tetanus toxin. Those toxins look pale in comparison with the toxins associated with root canal teeth. We happen to see in this office people who have had a root canal and only within weeks then be diagnosed with an autoimmune disease. And there's nothing else that they can point to. So they begin to think, could it possibly have been the root canal? Even though that's frustrating, oftentimes we find that people's health really improves when you eliminate the toxicities associated with dentistry. Mercury has been used in dentistry for hundreds of years for two reasons. One is it's cheap, and two is once it's placed with other metals and in what's called an amalgam and put in a tooth, it lasts for years and years. The disadvantages to mercury are this: it's considered the second most toxic element on the planet, only behind plutonium. It's so difficult for me to imagine how could we ever in medicine or dentistry use something with that toxicity and put it into someone's body. The largest exposure that you will ever have to mercury is from your fillings. You get a 24/7 exposure from the mercury filling. That continues to leak the vapor out of the filling for the life of the restoration. If you want to induce an autoimmune disease in a laboratory animal, you do it via mercury. If you want to depress an animal in the laboratory, you do it with mercury. Mercury stifles our immune system. There are very few elements, maybe plutonium only, that would have the impact on our health that mercury does. Every day, a physician, a biochemist, a health practitioner sends their patients here asking us to remove those because of the challenges to their immune system. When we remove mercury, we follow a very strict protocol that has them on vitamin C IV. We also drape every tooth in what's called a rubber dam so that none of the little particulate from the filling material goes down their throat. In addition, we use copious amounts of water spray to virtually drench the mercury vapor that comes off the filling when it's removed. And we have what are called negative ion generators in every treatment room, which not only blow over the patient, but blow over the dentist and the staff to push that down to the very foot of the chair that the patient's sitting in. And there we have actually a mercury collector. So all of those things are part of the protocol that we use when we're removing mercury. A cavitation is a sluggish area in the marrow of any bone. Any lesion or any area in the body that doesn't have an adequate blood flow to it can develop a toxicity, and they do develop amazing toxicities, upwards of 100 different anaerobic bacteria in a single cavitation. A cavitation typically will occur in the jawbone in the site where a tooth has been removed, because once a tooth is removed, oftentimes a protocol is not followed in the course of removing the tooth and in post-operative care of the patient. And so the clot itself that fills in that jawbone does not develop fully, and consequently you end up with an area under the little crest of bone that forms. You end up with an area that can be like a little cesspool of bacteria that's encapsulated within the jawbone.
And in order to clean those out, it's a very simple procedure where a little incision is made in the gum tissue over the site, and then we are able to just press against the bone in that area with a small rotary instrument and fall into that cavitated area, and are able to clean that out until we have good solid bone all the way around, that then the body can come in and do its job. Even if a root canal or mercury fillings, old extraction sites, the cavitation sites, are not directly causing the health problem, they are affecting the immune system in an adverse way, and so removing those is always going to be a benefit to the patient. The protocols we follow were developed by a doctor who has been doing this for many, many years, and so we feel like all the protective parts of this protocol that have been developed make a big difference in patients' treatment while they're here and also in their recovery. Conscious sedation is basically a way that we can provide patients with a very comfortable way of having one tooth worked on or their whole mouth worked on. And we do that by using an IV. So we have direct access into the blood flow, and we use a combination of medications that make you very sleepy so that you will fall asleep, but it's not the same as general anesthesia where you're completely out and you're not breathing on your own. If I need to get you to move around a little bit, I can wake you up a little. I can, if it's a long procedure, take you to the bathroom if we need to. Also makes the recovery easier because the medications wear off a lot quicker. You're able to walk out of the office instead of having to have a long recovery time.
And these patients are able to breathe on their own, they swallow on their own, they have all their own protective reflexes, but they don't remember the procedure, and it has amazing time compression to it. A 6 or 8 hour procedure can seem like an hour. And the anxiety associated with the procedure just goes away when you use conscious sedation.
Biocompatibility testing is where we take a blood sample and send that in, and the lab will test the serum in the blood against many different types of dental materials, not only filling materials, but also materials that could be used in a crown or a bridge, or in a partial denture or in a full denture. And we even test the types of temporary materials we use and cements that we use under a crown or a temporary crown. And the benefit for that is that we can see exactly what your system can tolerate versus what someone else's can tolerate. Having materials in your mouth that aren't compatible with your system are producing an effect on you, whether you have pain or not. They wouldn't necessarily cause pain in the mouth to be causing a problem in your immune system or in your overall systemic health.
The body's a wonderful machine, and it just needs the safety and the support and a quiet environment to begin the healing process. And that's our goal. And we begin that with the first acupressure the night before, because it offers the person an opportunity to develop a trust and relaxation. The second one follows immediately after, and that's so that patients can be quiet and develop a good blood clot, finish their IV, and once again it addresses the area where the treatment occurred. I don't see the pain, swelling, and bruising occur, minimal. It's just rewarding to see them come into my room post-op and just take a deep breath and know that they're going to be able to rest and relax, and they feel safe. And that's why we use acupressure to help the body to heal.
One of the really exciting new protocols we have to offer here in the office is the use of oxygen ozone therapy. Basically what ozone is a supercharged oxygen molecule that is used to sterilize the environment. It'll kill bacteria, viruses, funguses, and we can use that in place of using antibiotics in many cases when we're trying to clean up an infected area. We really are excited about the possibilities for treatment in many areas of the practice, including periodontal disease. We want to use the oxygen ozone therapy and infuse that down into the pockets where we can't always reach. Another area is in infected areas of the jawbone, such as extraction sites or old extraction sites known as cavitations that need to be cleaned out and sterilized. We can also use the ozone to treat sensitive teeth and desensitize those areas.
Since we are more familiar with which materials are biocompatible for adults, we pass that on to the way that we treat children. I would not want my own child to have a mercury filling or a stainless steel crown. It's great if we can see the children when they have their first dental experiences and make sure that they don't start off on the wrong foot in terms of materials. You know, in terms of treating children, we really like to focus on prevention. You know, preventing tooth decay in ways other than fluoride and other than traditional sealants. When a child comes in and they have a demineralized area, we can treat it with things like MI paste, which provides calcium ions back to that tooth. We use sealants that don't grab fluoride and pull them to the tooth so that the kids aren't having an excess exposure. When it comes to wisdom teeth, we assess each patient on a case-by-case basis. They have a panoramic x-ray, and we see if we think that their wisdom teeth will be able to come in into the proper occlusion. And if they can, we don't recommend that everybody have their wisdom teeth extracted.
When you lose your health, it is devastating. And several years ago, I was diagnosed with severe rheumatoid arthritis. I was 39, I had 2 little kids, and I just wasn't willing for what the doctors told me was my future to be my future. And I pursued alternative medicine, I pursued a lot of different things, but one of the stops on my journey was here in Marble Falls with Dr. Nunnally. He educated me on the root canals that I had in my mouth, the mercury, how it could be wearing on my immune system every day and could have, if not caused the RA, it certainly wasn't helping it. And so I came here, I had some pretty major surgery, addressed all those issues, had a great experience. You know, while I'm not 100% back, I am healthier, I am better, and more importantly, I have the hope of knowing that I can completely get my health back.
In 2001, I was having pretty bad sinus problems. Went and had sinus surgery done, and within 3 weeks I developed severe pain. That pain was so bad that I couldn't function. It was bad. So at that point I started seeing doctors. I started getting a lot of, we can't help you, go to this specialist. I think I'd seen 37 specialists around the country by the time I saw Dr. Nunnally. So I came here and the cure started at that point. We extracted some root canals which were poisonous. I had a very large cyst above one of them, and there was a perforation in my sinus that kept causing infection. And basically it would have never healed if we hadn't removed it. I started getting my weight back and feeling better. And at this point I'm practically 100% right now.
I guess I've had dental health issues for years, and I had what I felt was a systemic inflammatory response going on, just a significant amount of joint pain, and I kept thinking there should be a way to get better. There's got to be something I'm not doing or something I could change. You know, I changed my diet, I'd done all those things. I would try to exercise and I would get worse. And so everything that I was trying, I wasn't winning, and thought there's got to be something else. Oh, just from the time I made my first phone call here and walked in the door, a lot of TLC, a lot of comfort. It's a very emotional thing, which I think when you're sick for that long, you need somebody who's willing to listen and not make you feel any crazier than everybody else has already made you feel. And I knew that they could do it all at once. You know, they just put you to sleep and you wake up and it's all done. I could actually get up out of bed the next morning. I didn't walk like an old woman. My joints felt tremendously better in a short amount of time. It's been a wonderful experience.
It's just so nice to work in a place where not only are we taking care of your mouth, we're taking care of your body.
It's a very safe environment, it's a happy environment, and we're just all blessed to be here.
I mean, we have such a wonderful staff here. It's unbelievable to have so many people working together that get along so great.
I love the position that I'm in. I also love Dr. Nunnally and Dr. Freeman. They're awesome, and it's a Christian family.
We're more than, I think, a dental office. It's just a real caring place. It's wonderful.
We do care deeply about our patients. We want them to feel comfortable when they come in here and happy when they leave.
We want them to walk in and experience this as if they were walking into someone's living room. We want to welcome them as if they're guests in our home. And we really feel like family here, and people that come to see us, they start to feel that way too.
We're a 5-star service. You know, plain and simple. From the minute the patient walks in the door to the minute they leave.
We put Jesus Christ first. And I truly believe that we're blessed by the Lord, by the patients that He brings to us, because we are servant-hearted.
Our #1 prayer for our patients is that it's not us. We're not doing the work, but we're doing the work through Christ.
I truly believe that God allowed me to be brought back into this practice, that it is a huge blessing that I'm able to practice with this particular team, that all of us are here for a reason, and that each patient that comes here, we have a chance to show a picture of Christ to them and how we treat them, and encouraging them not only in their physical health but also in their spiritual health.
This office is completely dedicated to the Lord. We would not consider working a day without having our lives in the office surrendered to Him, and we wouldn't consider ourselves able to do anything without Him. So it's a ministry. It's an absolute joy, and it's a privilege to think that the Lord would trust the patients that He has to us.